This is Tim Organ. Welcome to the Rebels with a Root Cause podcast.
We're so happy you're here. So for those of you who don't know who Dr. Elisa Song is, why don't you introduce yourself?
Yeah, so I'm an integrated pediatrician, pediatric functional medicine expert. My skill is in translating complex topics to children and families. I love to teach practitioners. I have a practitioner membership and a parent membership so that people all over the world can get evidence-based, trusted information about integrated pediatrics. And we have a supplement line coming out too.
Wow. So many good things. And I love that trusted, right? Because sometimes people don't know who to reach out to, and you definitely are a pillar in that level of trust. And it's great that you have practitioner training because that's so important in this world, right? It's to be able to train these amazing practitioners so they can go out and serve the many, which is so important because that's how this thing rolls.
Yeah.
Right?
And, really in terms of pediatrics, we know that there's been this whole movement in the longevity, the adult space, hormone space. It's got to trickle down to the pediatric space.
Well,
so
honestly,
it's time.
Honestly, it should start there.
That's
Say that.
That's right.
Yeah. So I'm a little biased there, and I know you are as well. So, all right. So, Dr. Elisa Song, what is your rebel story?
So I would say I've always been sort of a quiet rebel, and it's just been something that has been just a part of my upbringing, I guess, is just to kind of really learn to follow my heart. And so I was never going to go into medicine. I saw my mom working like a dog as an OBGYN, private practice, but I knew I wanted to work with kids. And so I thought I was going to be a teacher. I thought I was going to be actually a public policy lawyer, children's rights advocate. And in the late 80s, when I was at Stanford, I saw this flyer for the American Holistic Medical Association. And I thought, what is that? I'd never heard of holistic medicine, right? So as a junior, I'd already taken the LSATs, already decided I was going to apply to law school. I drove myself to the Santa Clara Convention Center and I was riveted. And I heard from folks just getting known like Andrew Weil and Deepak Chopra and Joan Borisenko. Marianne Williamson was there. And then I thought, okay, that's what I want to do. So back then, I remember calling my mom on a landline and saying, hey, Mom, I want to be a naturopathic doctor. Nobody knew what that was. Nobody discouraged me, but nobody really encouraged me. So I found myself in medical school at NYU, just not liking any of it, right? Every year, the first year I went, I said, I don't know that medical school is really for me. Like, I'm not seeing what I want to do here. The dean said, well, just give it another year. First year, right? Went to her my second year. And I said, I'm really not liking it. Wait till your third year. It's your clinical years. You're going to love it. My third year, I had already found an integrative medicine elective. I said, I want to do that. I had started the alternative medicine group of the American Medical Student Association. And I thought, okay, this is what I want to do. And then she said, let's wait till you're a real doctor, right? And I said, well, I don't know that I want to be a real doctor, how I see it, right? And so I said, I think I'm done. I don't think this is for me. And then she said, just one more year. So there I went, graduated med school, and still not seeing anything that I wanted to do. So even in residency, just had to pave my own way. And I found it. I mean, it was hard, but I paid my own way, found functional medicine, found integrative medicine, always with an adult bent. So I had to translate it into pediatrics. And so now that is why my mission is to make it easy for pediatric practitioners to practice in this way so that they don't have to forge their own path and they don't have to feel alone.
That's amazing. I mean, you are really a true entrepreneur, of course, right? But you're also an innovator, right? The fact that you could see that so many years ago and be drawn to it.
It was a lot of years ago, right?
You found it. Now, what was the friction that you were seeing, in the medical school? What was it that was, drawing you away from it and drawing you to more of the holistic integrative approach?
So there were different frictions in medical school and in residency. I went to NYU medical school, and back then, so this was in the early 90s, it was heavily, heavily male dominated. I mean, there's only one female dean of students. In my surgical rotation, it was only male surgical attendings. I was a favored student there. I got to do a lot of things, right? Because I was the only female medical student in that rotation I happened to be on. I had a lot of fun, but that culture was not anything that I wanted to be a part of. And it was the only thing I saw in the hospitals and in rounds. So that just nothing nurturing, nothing healing, nothing supportive of families who were struggling. And then in residency, the friction there wasn't, I mean, I was surrounded by pediatricians. Pediatricians are nice people, right?
Yes,
I
they are.
mean, most people
Yeah.
who go to pediatrics, they do it because they love the kids and they have a heart and they want to do good. But I just kept seeing kids who were sick, cancer, autoimmune conditions, and we were catching them when they were really sick, and we were putting them on these medications with such big side effects. And I just kept thinking, where are we practicing true preventive medicine? In the primary care setting, this idea of anticipatory guidance and preventive medicine, where was that? Right?
Right.
All of those visits were basically only centered around developmental milestones and the vaccine schedule. I mean, that's it. But developmental milestones, you're not helping to prevent developmental delays from occurring, right? We weren't talking about nutrition. We weren't talking about the gut microbiome. We weren't talking about brain development. And so that's where that disconnect for me, I just didn't feel right practicing medicine in that way, which is why after residency, I decided I'm not going to practice medicine in my mind. I went back to public policy school because I was going to go do what I was intending to do originally, become a lawyer, do public policy, and I might as well be a children's health advocate on a bigger scale. And it was at that moment, that pivotal moment, where I was making this decision where, again, another flyer, ran across this flyer, food as medicine. I mean,
Wow.
what a concept.
What a concept.
This was back in, in 2000, right? And I thought, what is that idea, right? And so I went to this conference. It was at Berkeley, and I heard from a very young Mark Hyman.
Yeah, that's been his tagline, right?
And also heard about mind-body medicine because it was put on by Dr. James Gordon and the Center for Mind-Body Medicine. And that, I knew that's what I want to do. That centering on the mind, the power of mindfulness as medicine, the power of food as medicine. How do we heal from the inside out? Root cause medicine, all those catchphrases. I mean, I was hooked. Then I knew, okay, I am going to practice pediatrics, but I'm going to do it that way.
Yeah. So this whole concept, we've heard it all the time. I mean, as you know, I think you know my history of being in big healthcare sales for 33 years and working very closely with doctors. I was calling on some of the biggest health systems, public, private, and saw a lot of change over the years. And I was so conditioned by the establishment to look at doctors that didn't come out of traditional medical schools as not doctors.
Yeah.
Right. So how did that, when you first heard that, you're not a real doctor, right? Did you hear that a lot while you made this transition? Because back in that day, that's a big move, right?
Well, in a way, I was lucky that my path led me down the path that it did, because had I not gone to conventional medical school at NYU, I think there would have been a different way of perceiving my skill set, my knowledge. And, being an undergrad at Stanford, going to NYU, and then doing pediatric residency at UCSF, nobody could say that I didn't have the right training, right? And when I decided to really open my practice back in 2004 as an integrative pediatric functional medicine practice, I mean, I had some people looking at me sideways, but they knew me. They knew that I had a head on my shoulders. They knew that I wouldn't just be some quack out there, not really diving into the evidence. And so I was fortunate because not all practitioners have that ability to do that.
Absolutely. You've got both sides, right? Yeah, that's solid. Nobody can say anything about your credentials because you are well credentialed.
Well, I'll tell you the idea around, not being a real doctor. Another time that came up was actually in medical school at NYU. We're at a bar. These guys are
always starts at a bar.
Always starts at the bar.
Couple guys and gals at a bar.
Right. So we're at a bar, me and my friends from med school, and a couple of guys are, business guys are trying to pick us up. And so I'm chatting with someone and he's like, "Oh, you're going to be a doctor. What kind of doctor are you going to be?" And I said, "Well, I'm going to be a pediatrician." And he looked at me and said, "Oh, I thought you were going to be a real doctor."
He was questioning pediatrician as not being a
Yes,
real
the
doctor.
pediatrics part of it,
Really?
which was,
Huh.
so
That's-
offensive,
yeah.
right? It took all I could to not throw my drink down, on his pants, right? But that too, I do get that too, right?
Yeah.
That adult medicine somehow has more credibility than pediatric medicine. It's
Yeah.
like, just like we've said, where should we start when we're thinking about all of these adults now trying to biohack their way into a healthier, longer, healthier lifespan and health span? Well, I'm sorry, but that imprinting starts when you're a baby,
Yeah.
right?
Yeah. So talk about the 21 years, right? You opened this office in 2004, and here we are in 2025. Talk about the progression of what the complex cases you've been seeing, because you made mention that that's one of your gifts, right?
Yeah.
Like you love the complex case. Like what does that trend look like, over the last 21 years?
So I will say that the rise in the number of kids with neurodevelopmental concerns is unlike anything I could have imagined. When I was a pediatric resident, my second year, we all did a developmental and behavioral rotation. And we had an autism clinic at UCSF. It was where, lots of families from across the Bay Area would come. It was one of the few autism centers. During that rotation, I saw one child with autism. And I remember being told by my attending, if you see a handful of kids with autism in your career, that's going to be a lot. Yeah.
Yeah.
That was in 2000. That was in 1999. And when I opened my practice, oh my gosh, the families in need that came pouring in. And now, of course, as it's not just as diagnosis gets better, I think we are identifying kids who did fall through the cracks before, because now we know that there is a spectrum of autism and autism behaviors, right? But I'm also seeing kids with behavioral concerns, ODD, OCD has been skyrocketing, and this condition called PANDAS, right? Pediatric acute onset neuropsychiatric syndrome, sometimes associated with strep, in which case it's called PANDAS, where kids can have either a sudden or subacute onset of anxiety, OCD, rages, food restrictions, cognitive deficits after an infection. That wasn't even a diagnosis when I was a pediatric resident. What also wasn't a diagnosis when I was a pediatric resident was sensory processing disorder. And so many kids now don't know how to be comfortable in their own skin. Sounds bother them, textures bother them. And I don't mean just bother them. They can't handle the toilet flushing or the blenders or the whatever it is, right? So we have this whole set of sort of neurodevelopmental and neuropsychiatric concerns that I think even now residents and medical students who are heading into pediatrics, they're not prepared for, right? And this rise in autoimmunity, it's shocking to me. How many kids have autoimmune problems and autoimmune evidence in their blood work. And then we have, on the other hand, too, metabolic disease, right? The number of kids that I'm seeing who have high insulin levels, high hemoglobin A1Cs, all the signs of heading towards type 2 diabetes in fit-looking, slim, athletic teenagers, too. Right? These are not the picture of who you think of as having diabetes or metabolic health. But, this world is not serving our kids. And so it's up to us to identify the problems, the triggers, and then to really be advocates for them.
How are you dealing with these patients? Is it through diet or exercise? I imagine there's some other things that you're doing. Can you talk about those?
Yeah. In functional medicine, you always start with the gut. It's especially true for kids. Right. And so, with more specialized microbiome testing, we can find some fascinating insights that can really help to turn things around for our kids, including, what kinds of inflammatory markers they have, especially something called LPS, lipopolysaccharides, which I want every practitioner working with kids to know about. I do baseline blood work on every kid that comes into my office if they're coming with a health concern. I also see primary care kids too. But we need to identify nutrient deficiencies or insufficiencies, which are rampant, so that we can give them the best chance at course correcting. And then in terms of working with the kids, it's a family affair. But I always tell families, your child is my patient, right? I tell teenagers, you are my patient. You are who I'm collaborating with in the context of your family. And so it's always about educating and empowering the kids and the teens, no matter how old or young they are, right? Even, I mean, little kids are so amazing. I mean, they can be if you talk to them about why it's so important to take care of those trillions of tiny little friends in their tummies, and look, here are the foods that you want to feed them, or here are the foods you want to keep out. They are often better polices with food labels than their parents.
Yeah. That's so exciting because it's, I'm sure you just love to see them, their eyes light up, right? Because now they're in charge of their own health.
That's right.
And you're really setting this intention with the next generation.
Yeah.
Because this is where it starts, right? You look at, the adult population, and there's, some major challenges in that, right? But if we can stop this from where it's beginning, right? There has to be a point where, we can start to reverse these curves, right?
Yeah.
Or these lines that, it's, chronic disease is going through the roof and it's not coming down, right? So, and we know there's a lot of things out there that are causing this, too many to even bring up. But, from a standpoint of really getting them back to, or at least getting them back to somewhere where they can, live a normal life. What does that look like?
It looks like teaching them how to make choices. Right? I mean, the first thing is really helping them to get more in tune with their bodies and their brains. That's like just recognizing how certain foods or certain activities help serve them or don't. Because once you're in tune with that, you can make informed choices. They still might choose to do the thing that doesn't make them feel great, like having, a huge bowl of ice cream and a boba tea at the same time and the whatever things, right? Maybe they'll choose that. Some adults choose that too, right? So we can't ever like blame or shame, right? But then it's knowing, okay, if I do that, I'm going to feel crappy the next day. I know I'm not going to be as great on the soccer field, or, oh yeah, I have a test tomorrow. Then they start to at least connect the dots, right?
Yeah.
That is really important. In putting the power back into kids' and parents' hands, it's also really important for me to make sure that they don't feel guilty when they make choices that maybe aren't in their best interest, because we all do that. I mean, that's part of human nature. And it's also the addictive nature of foods and screens and all of that, right?
Yeah.
And there's not a single adult that I know of who hasn't caved every once in a while. That's okay. It's in the context of building overall resilience, right? Like overall, how do we make the choices every day that can help us bounce back no matter what's going on, so that we don't tip over into autoimmunity or tip over into anxiety or, whatever else is going on.
So you talked about your practitioner training program. And so how are you getting that word out, and who is your target audience? Is it the doctors, the pediatricians that are in the system that really want to come out and practice medicine versus doing what they're doing, treating the symptoms, not treating the root cause? Do you find a lot of those doctors who are finally saying, I'm done? Like, I don't want to be in this environment anymore. It's not serving me. This is not what I went to medical school for.
Yeah. I mean, my membership now, it's a beautiful group and it runs the gamut. We have health coaches in there. We have PAs, NPs, MDs, DOs. Some of them, and many of the MDs are pediatric providers who they don't know where to turn for this education. Because sadly, most of the larger functional medicine training organizations, they're not focusing on pediatrics. So it's kind of like me 20 years ago trying to piece everything together. So A4M now that I'm chair of their pediatric education, we hold our annual conference.
Yeah.
But otherwise, there's very, very little pediatric functional medicine education out there.
Yeah.
And so that's what they can get in my group, right? To really get that foundation and more advanced training. And then I have some practitioners who have been doing functional medicine. Maybe they're seeing adults, but of course, if you start seeing parents, they say, hey, can you see my kids too, right? And so they want to know how to translate their adult functional medicine knowledge to pediatrics, because kids are not just little adults. We have to treat them like the unique kids and also adolescents or middle school kids that they are.
Yeah. So one of the things I've talked about, and you weren't here when I was on stage on Saturday, but I talked about really about my vision as to where I see the future of health going. I basically launched what I would refer to as the New Health Paradigm Alliance. And this is going to be an organization that's going to bring the practitioners, the doctor, the tech companies, the lab companies, the supplement companies, the technology companies, the red lights, all these modalities, right, that are so healing, that doesn't require a prescription. So I'm bringing all this together, and I asked myself when I was preparing this, where do I start? Where does this start? And where we start is primary care, because the proliferation of primary care, independent primary care physicians who, because of the ACA, the Affordability Care Act that was signed in 2010 of March, the requirements for these physicians were so difficult that in the end, they ended up selling their practices to the big health systems. And what we've seen is with the rise of acquisitions, chronic disease rise as well, right? So one of the places we can stop this, right? We can top a funnel, and guess where top of funnel is? The pediatrics, right? And it's primary care. These are the gatekeepers. So if we can stop it there and we can start to move them in a different direction,
I mean, that would be huge because, I will say I am one of the few pediatric functional medicine providers that still does primary care. And even adult functional medicine practitioners, many of them have let go of primary care. So reaching the primary care physicians and the pediatricians to help support families, adults and kids, before they get really sick or at the very beginning of their illness, the very start of their eczema, the very start of their asthma or their autoimmune condition, where if you intervene then, there's so much less to unravel later on in life. I think that is the perfect place to start. We have to make primary care more financially feasible for practitioners, right? And move outside of the system for sure, because you can't accomplish anything in a 15-minute well visit.
Right. Do you think the system will ever look at this and say, we need to start moving to a more functional approach to treating these patients?
I think I don't necessarily see it in primary care because the way in the current insurance model, primary care practices, because they're not procedure based, they don't have another source of revenue. They must be volume based, and you cannot practice true prevention if you're volume based. Right? If you're seeing 24 patients a day, you barely have time to eat lunch. I mean, there's no way that's going to happen. Now, I do see health systems incorporating functional medicine practices, clinics. I think that is going to happen more and more. And if we can capitalize on that and maybe have that trickle into primary care physicians knowing immediately when to refer to those functional medicine practices, that would be great. I can see that happening.
Yeah. My hope is that the large electronic health record systems like Epic and Cerner will incorporate these types of apps into their ecosystems to allow for this thing to run act like a functional medicine, front end system.
Yeah.
Right. So it's going to be able to provide some help in the diagnosis of what this is. But, and with AI, I think we're going to start to see a lot of these walls being broken down, because we're going to start to see more democratization of health, and individuals are going to start to take control of their own health, and they're going to demand things that most likely are going to not be insurance based. So there's a whole set of things that are, we'd like to unravel here and really shift. But I think what we need to do is start with an individual like you who's really out there, training up these practitioners to start to serve more, because the more of those individuals we have out there, the more options, right? Because you can't handle them all, right? There has to be an army of individuals that are out there being trained to be able to start to make a bigger impact.
Yeah. Right? Well, and that is one of the questions, because I still have practitioners who are in the system, right? So what kind of things can you do when you're doing the finger prick on a 9-month-old to see if they have low iron and you're recommending iron supplement? Well, if you're actually sending them for a blood draw for a CBC and a blood lead and an iron level, add a vitamin D. right?
Yeah.
Just check that, add that to your list.
Yeah.
That would go so far in helping our kids. If you have a baby who's born by C-section or receive antibiotics during delivery, it should be standard of care for mom and baby to receive probiotics and guidance on restoring the microbiome. I mean, that to then be able to restore that baby's gut-brain connection, gut immune system connection, we could practice so much prevention. So I think if we have these protocols in place that are easy to implement, it doesn't take a lot for that primary care pediatrician to have to think about it,
Right.
because now it's part of the protocol.
All right, let's talk about your book, right? Why don't you let everybody know your book title
Yeah.
and how they
Yeah. So my book is called Healthy Kids, Happy Kids, an integrated pediatrician's guide to whole child resilience. And it's basically anywhere books are sold. Amazon, Barnes and Noble, Walmart, Target. I wrote the book with kids and parents in mind. Although now I have so many practitioners who've read the book, love it. They're actually giving it to their patients before they even start working with them, so that they have a foundation of, this is what we're going to talk about. This is how we live. This is how we eat. This is how we nourish our microbiome. It takes so much of that explaining away from what physicians have to do in their busy practices. And I love that different medical centers are starting to notice and pay attention. I've been asked by UCLA to speak with I did a grand rounds for their nursing school, and UCSD for their medical students, Cleveland Clinic grand rounds. So I am hopeful that the more this gets out there, and becomes doable for pediatricians, we'll get at least some elements of it into the system.
It's a great start.
Yeah.
Right? Because once they get a taste of it and the patients get a taste of it, right, they're going to demand more.
Yes.
That's the most important thing, just to make them aware. And the fact that this is now starting to go viral, this book, right? Let's call it what it is.
Yeah.
You are ascending, and it's so great to see that you are that bright light out there that is really shining what it really means to become a true, functional medicine practitioner that can deliver amazing results without doing the things that a conventional medicine doctor would do.
Thank you.
So thank you, Dr. Elisa Song. Appreciate your time.